everyone, Dr. Ellie here with my podcast, I Heal Kids. Again, I'm excited to bring you some really cool information today. If you don't know me, I am Dr. Ellie. My practice is Middle Path Integrative Pediatrics. And if you're seeing on YouTube, this is the exam room. And my practice is in Asheville, North Carolina. So if you are in or around Asheville, North Carolina, and you need a holistic pediatrician for kiddos 0 to 21, please reach out. Also, if you need a functional medicine consult to increase longevity, vitality, for pre-fertility issues, for gut issues, for brain health issues, a whole list of issues that you can find on my website, ages 2 to 102. I am happy to see you for that as well. All right, well, let's dive right in. So, okay, colds. I feel like this is one of those topics where everyone is kind of like, okay, like I know what a cold is. And yet if we sit and think about it, it's kind of like, well, do I? Like what it really is a cold? I mean, I guess I get like a runny nose and stuff like that, but like how does it happen? And like, why do I have it? And how can I prevent that? And so I wanted to dive into that topic so all you guys will know more about colds and how to prevent them and how to treat them. So on that note, what is a cold? So let's just define it, because honestly, sometimes you just need a definition to kind of wrap your head around things, because sometimes it's like, well, is a cold a flu? Or, what is a cold exactly? Is a cold the same as coronavirus? I don't know. So a cold is when you get inflammation of your upper respiratory tract, including your nose and throat. It gets inflamed because of a virus. And we'll talk about what viruses later on. And this leads to increased mucus production, swelling of the nasal passages, congestion, nasal congestion. And that all causes the symptoms that we're so familiar with. So like the runny nose, the stuffy nose, the sore throat, sometimes a cough because the mucus is like dripping down the back of the throat. That's where you get all that rumbly, yucky, chesty sound sometimes from a cold. Or in young babies, you'll feel like a vibration on their chest. So essentially, it's like the virus that is irritating our mucous membranes in the upper respiratory tract, is causing inflammation, discomfort. So we're going to talk about, a holistic approach to treating colds, combining like the mind, the body, environmental factors, natural remedies, lifestyle adjustments, when to seek medical care. So lots of good information, no fluff. So hopefully it will help you guys out. So we kind of talked a little bit about what a cold is, but let's dive a little bit deeper, because I think we can even go a little bit deeper with the science. So, if you don't want the science, skip ahead this like minute or two, but I think it's kind of fun sometimes to like throw a little bit of the sciencey stuff in. A lot of times I have parents that will come to me that are kind of freaked out because the ER or somebody told them that their kid has an upper respiratory infection, which sounds terrifying. And no one told them, that is a common cold. And so they're thinking like, oh my gosh, my kid has this like super horrible illness and infection of their upper respiratory system, and what even is that? And so the upper respiratory system, you guys, that is just referring to the nose, your nasal cavity, your sinuses, your throat, and your voice box. So we have an infection of basically, if you see me on YouTube, this area up, if you're listening, the neck up kind of area. So we're not moving into like the lungs and the breathing tubes, like the bronchioles or the big main stem bronchus or anything like that. So nothing like below, kind of lower down. Okay, so that's upper respiratory. So when we say upper respiratory infection, in general, people are referring to viral infection of those upper respiratory areas, aka the common cold. So what are these like? Why do we have all this like system? Like, why do we have this upper respiratory system? What is it even doing? Okay, well, a couple things. So first of all, it's going to filter and warm air. So especially like in your nose and things like that, it wouldn't feel very comfortable if that, at the time of this recording is January 20th in Asheville. It feels like 5 degrees Fahrenheit. And if we inhaled that into our lungs, it would burn like all heck, like all get out. And so we need to warm that air up. And so the nose and the nasal passages and the cilia and the mucus and all those things, that'll warm the air up. And not only that, it kind of helps humidify it. So, it's super dry out. I don't even know what the humidity is, but I can tell you my skin is peeling and cracking without lotion. It is super dry. So all of that, like moisture that's in our nasal passages and our throat and everything, that is humidifying the air. So it helps like when everything goes into the lungs, it's nice and moist, it's nice and warm, and we're not getting like discomfort. And the other thing it does too is we have like little nose hairs, which, especially some of the dads out there are like, can I just please get rid of my nose hair? But I promise you, those little nose hairs are doing something. So they are trapping dust and they're trapping other little particles that we don't want to go into our lungs. So that is kind of what the upper respiratory system does. So what are like the viruses that even cause a cold? So I think this is confusing because sometimes we talk about a bunch of different viruses. And I think what people don't realize is that many viruses can cause a cold. And some of the viruses that cause colds can cause other things too. It doesn't mean that they're going to, but they could. And so that's where it gets a little bit muddy for some people. So there's 100 different types of serotypes or different types of viruses that cause cold. And some of them I'm going to list here. We're going to get a little sciencey today. We'll see how it goes. But one of them is a rhinovirus. And that is like very common cold, like what we think of typically with a common cold, peaks in September, kind of fades again in March and April. RSV, we may do a fuller, deeper dive on RSV. Sometimes it just causes a common cold. Sometimes it goes down deeper and causes something called bronchiolitis, which is inflammation of the tiny little airways, among other things. So we're going to take a deeper dive into RSV later, because that's way outside this episode. But that can cause a common cold as well, typically November to March. Influenza, you can have full-on flu, or you may just get a head cold. Peaks in February. It can also cause croup, which we can talk about another time, and pneumonia. So not all pneumonias are bacterial, you guys. So that's something we need to remember. Paraflu, parainfluenza, that's another one. It lasts from September to January with a peak in October, November. It can also cause croup, which is swelling of the upper kind of throat area. And we're going to talk about that one later too. Adenovirus, you guys, I just want to touch on this one because this one kind of freaks people out. This is a virus that causes something, it can cause just a cold, but it can also cause something called pharyngoconjunctival fever, which is a super big word just to say that it can cause this kind of constellation of symptoms where kids get these like super red eyes, almost like they have pink eye. And then they get a fever and a sore throat and plus or minus the cold. And that is adenovirus. Enterovirus, that's another one. It can also cause other things like hand, foot, mouth disease, herpingina, which is sore throat that has light gray and red. Let me try that again. Kind of spots that are light gray with a red border in the mouth. SARS-CoV-2. Most of us are familiar with this. This is like what we typically think of with like COVID. So sometimes it can just cause a cold or sometimes it can cause other things. So we can dive into that one if you guys want to. And then if you didn't know, there's a lot of different coronaviruses, not just like the one that we think of that started in 2020, like the pandemic. There's like a lot of coronaviruses. So it's not the only one. And those can cause colds too. The last one I want to mention is human metapneumovirus. And we see that kind of late winter, early spring. And it can also cause pneumonia and bronchiolitis, which is that inflammation of the little airways in the lungs. So lots of things can cause colds. What is like, okay, so like you get this virus and what happens to your kid's body? Like what is even going on? Like why are they getting these symptoms to start with? What happens is actually a lot of the symptoms are actually a result of the body's natural immune response to the virus and not direct damage from the virus itself. So the cold virus gets in, so like you breathe it in, someone sneezes, whatever, however you may catch it, and it gets inside. It enters the body through the nose, through the eyes, and it attaches itself to those cells. So let's say you have a little kid that touches something and then they rub their eye, and then the virus gets in their eye and then it attaches itself to those little cells that are in the eye, okay? And then once inside the body, the virus starts to reproduce in a few cells in the nose. And so as it's reproducing, it sends out a message, sends out, like a text. Not really, but that's kind of how it works. Sends out a signal, kind of like a text message called a cytokine to call in help. And what is the help? The help is something called a white blood cell that fights infection. So it's like, please help me. And so it's sending out these cytokines, this text message for help. And guess what? They come and they build up in the nose. So now your whole nose is blocked with white blood cells that are there to try and fight the infection, but you're just like, oh my gosh, I'm so congested. I can't get the mucus out. And what is it? It's those white blood cells. And you can get these symptoms like the runny nose, like 1 to 2 days after the virus enters the body, when the white blood cells basically flood your nose trying to kill this viral infection. I really want to talk about color of discharge because I get this question all the time. Like my baby's nose, they did have clear mucus, but now it's like yellow green. Like, is that a sinus infection? It may be, but oftentimes it's really not. It's actually just the fact that the immune system works to fight off the virus. And so the mucus might change from clear to yellow or green, not so much because there's a bacterial infection now, but because the immune cells are at work trying to fight everything off. All right, what else is going on in the body? So also, the virus can spread and increase the amount of fluid in the nose, like we had talked about before, but it can also cause the sore throat and everything. And it can cause like other things like achy body. Your body may mount a fever in response to try and kill the virus, which I have an episode on fever. So if y'all want to dive more into like what is a fever, how to treat a fever, all of that, go to that episode. We'll link that in the show notes. How do you transmit a cold? Like how does one person acquire it? There's basically 3 different ways. So one would be like hand contact. So either, you're touching something that has the virus on it, like a doorknob or like a toy or something like that. And then either your child like touches that and then they touch like their eye or their nose and then they get the virus coming in. Inhalation of airborne germs. So this is basically like someone sneezes or coughs and the tiny little droplets of the virus float around in the air and then we breathe them in and we're like, oh no, here it goes. We're getting a cold. The last way is like close contact with an infected person. So this is typically like what happens in family settings, or I have definitely had this experience as a pediatrician because kids do sneeze a lot and cough a lot, and that does happen. And so what happens is larger droplets from a sneeze or cough can land directly on the nose or eyes. And it usually happens when you're close to someone who's sick. So, you're attending to them and then they sneeze right in your face and you're like, yes, I am definitely going to get this cold now. And I think we've all been there. When it comes to catching common colds and, URI, however you want to call it, so the most common is contaminated hands and fingers. So that's just something I really want to emphasize because in kids, this is often the way kids get infected because we all know, young children, it's really hard. They're not thinking, oh, let me go wash my hands. They're 3 years old, 4 years old. They're not thinking, oh, I got, sneezed on. I better go wash my hands, that kind of thing. Another kid doesn't think, oh, I'm sick. Let me not touch that toy. If you're in a daycare setting, of course, everybody's playing with everything. And so, it's really common to get transfer through hands and fingers. Just something to kind of be aware of, that young children are often, they often tend to spread germs more than adults within a household just because they're young and they don't really, obviously think about that. Timing, proximity. I think a lot of us probably know from COVID, like the more time you spend with someone who's ill, more likely you are to get it. So that's why if you were super worried about something, like maybe you had someone in your family that had an immune disorder that you wanted to keep, from getting sick, then, isolation, separation, making sure you're not spending a lot of time next to someone, who's sick, that would be, a really helpful strategy. And again, this is why kind of like larger families or people, homes with a lot of people tend to like pass it around to each other. In fact, you guys, studies do show that even short contact, so like 10 seconds or less between hands, can transfer the virus. So if you touch your nose or eyes after like touching something with your hands that has a virus on it, within 10 seconds, you could be, having that germ spread to you. So things to do to avoid getting sick. This is why we talk so much about hand washing with soap and water. And I myself have to find that I have to be really aware, really cognizant that I am washing for 20 seconds because sometimes I will say 5 seconds feels like 20 seconds when you're in a hurry. So if you do have someone around that's sick and you're really worried about this, I do recommend either just counting like 1,000, 2, 1,000, or in little kids, you can have them say the alphabet, their ABCs. If you're really like diligent and you have a timer, but you really want to wash those hands with soap and water for 20 seconds. Alcohol-based sanitizer. So there's a lot of things with this. in the holistic world, and a lot we can say about sanitizers. Just a note though, like if you are actively like in a situation where you're like, I direly don't want to get ill, I mean, the best sanitizer as far as like killing the germs is going to be something alcohol based. If you're like in a low risk situation, you're just kind of generally sanitizing, maybe then you want to use something like more like holistic, like essential oil, thyme oil, that kind of thing. Okay, so based on everything we've said, obviously, and easier said than done, you guys, touching your eyes, nose, and mouth, unless you've washed your hands, not a good idea during cold season, flu season, anytime you don't want to get ill. And I will say, you know, as a person who wears glasses, I'm constantly like adjusting and things like that. Or like immediately, of course, you're like, oh, don't touch your nose. And then you have like an itch and you're itching. Try really hard not to touch eyes, nose, and mouth. Disinfecting probably goes without saying, but just make sure you do disinfect the house if there's a family member who's ill. And then again, you know, if you have people who are coming over who are sick, you may want to ask them to come back when they're healthy again, because it's pretty easy to get sick. Okay, so how long is my kiddo contagious? I get this question a lot. To make it kind of simple, we're just going to talk about rhinovirus because that's kind of the typical cold symptom or cold virus that a lot of people get symptoms with. And it peaks on the third day after inoculation. So let's say you touch something, you touch your eye or mouth, and the thing that you touched had rhinovirus on it. Then 3 days after you infected yourself with the rhinovirus, you're going to have like the peak in your symptoms. You know, I think this is important in situations of like, well, how long does it shed or how long is my kid contagious? So it may peak at 3 days, but then what happens is it actually sheds from the body, or like the virus still comes out of your body for up to 2 weeks. So if you have someone in your house with like cancer or something like that, where you're trying to keep them really safe, I do recommend staying away for 2 to 3 weeks. 3 weeks to be extra cautious, but definitely those first 2 weeks. Or if there's something that you're like, I have a wedding, I do not want to be sick, do not be around people who have, you know, cold symptoms a couple days later, because you are more than likely going to catch that cold. So again, this goes along with like, how long does it take my kid to get sick? So let's say they're like with a neighbor friend and the neighbor friend coughs and they breathe it in and things like that. But usually the time between that and the time that the onset of the cold for your kiddo could be 24 to 72 hours with the peak of symptoms at 3 days. Another question I get all the time is like, is my kid getting sick too much? Because a lot of people worry, you know, that their kid is like always sick and maybe they have like an immune problem, or, you know, we need to do blood work and make sure, you know, what is going on. But the truth of the matter is that kiddos under age 6, they typically will get 6 to 8 colds a year. And especially between September and April, where it's cold season, they can get a lot of colds. And since the colds last, you know, like up to 14 days in general, where they're shedding that virus, sometimes it just feels like they're always sick because they're just catching one thing and then another and then another. And you're just like, oh my goodness, they're getting a cold every single month, and one just runs into the next, and that's the end of the story. But that doesn't indicate an immune deficiency. And we'll talk about immune deficiencies in a different pod because that's just kind of outside this scope. But if your kid is getting a lot of colds, more than likely it's normal, especially if they're going to daycare, or if it's their first time in a childcare setting at all. So like the first time at preschool or first time in kindergarten, something like that. It's very typical to feel like your kid is getting cold once a month, and that's pretty darn normal. Don't worry too much though if your kid is in daycare, because really, again, your kid will most likely get colds either the first time they're in daycare or the first time they're in school. So the kids that aren't in daycare, they tend to get more colds later on. So you're just kind of balancing it out depending on where a kid is around other kids. Older children, adults, we typically get colds 2 to 4 times a year. They last about 5 to 7 days. And please, not that you would, but if you are smoking cigarettes, you may want to stop. This is another reason to stop smoking. If you do smoke, then the colds can last longer. So just know that, adults out there, that smoking can make colds last a little bit longer. All right. Well, I'm wishing you guys well, and I hope that was helpful. Please share this with anyone that you think that this information could help. Subscribe, all of that good stuff, like, and I thank you so much for listening, and I'm wishing you well. Bye.